Hello, I'm Larry Linehauser.
And I'm Robert Day.
Welcome to another segment of Lifelines. Rob, what you got for us today?
Well, today, my segment's going to be on weight training and weightlifting, and we'll be going to Southside Gym and talk to a personal trainer there and learn how you can exercise both at the gym and at home. How about you, Larry?
Today I'm going to focus on the world of acupuncture. We have a acupuncturist named Diane Glass who will be joining us and telling about what she does in Oriental medicine. So stay tuned. Welcome back to Lifelines. I'm Larry Linehauser. Joining me now is Miss Diane Glass. Diane is a doctor of Oriental medicine. Diane, welcome to the show.
Thank you, Larry.
Diane, acupuncture, which is one of the things that you do, in recent years has become quite popular and very much the rage. Can you give us a little background on what you do and acupuncture in general?
Sure. In my private practice, I've been a licensed massage therapist for 21 years, and then currently I've been practicing acupuncture for about, since the beginning of school, probably about 5 years experience with that. And I use acupuncture. Oriental medicine encompasses acupuncture, Chinese herbs, some forms of Tui Na, which are hands-on therapy as well. And then I have the massage modalities as well.
How do you explain the popularity of it now?
Well, I think actually acupuncture came to this country in the 70s when one of Richard Nixon's aides was in China. He was treated with it, and he was pretty amazed at the results. And then it became, there were always like the back room Chinese that were practicing in the big cities. And then I guess it was really about the 70s that you first saw the first schools cropping up in the United States. And then once that aide of Nixon's was cured, they started getting some legislation to pass, regulation of it, and licensure laws and things like that. And so it has just blossomed since then, and it's really booming now. You'll notice there's a school in Sarasota, there's schools popping up everywhere, and it's a master's degree program that you level that you do, and it's about a 4-year program.
Very good. What is the general premise of Chinese medicine as opposed to Western medicine?
Well, Oriental medicine and acupuncture works with the theory of yin and yang, where everything is to be kept in balance. And it also draws upon the 5-element theory as well, which is earth, air, fire, water, and these elements they have to be in balance as well. So you're looking at the influences of the external environment, such as cold and heat and wind, and those are very foreign concepts for Americans to think of, but all those things do invade the body and have an effect on the body. So it's keeping that body in a homeostasis within the energetic systems of the body.
Okay. How about, what are some of the more common problems people come to see you with?
Actually, I guess most often people equate it with pain management. But really, it's so much more than that. You can really ask me just about any ailment, even severe things such as MS and people that are on chemotherapy and radiation. There's some way that you can work in conjunction with the conventional treatment to help with the side effects, such as nausea and just the debilitation that some of those treatments take out of you. Very common also would be colds and flus, those kinds of things, menstrual discomforts, intestinal problems. You see a lot of that being treated. People are starting to understand that this is not just for pain management.
Good. Can you tell me how you see Western medicine and Oriental medicine interfacing in the future? Because obviously they're beginning now to work as complementary medicine, and you have doctors who are regular MDs who practice this, or have people, acupuncturists, physicians come in and work in their office and do continuing care or integrative care. How do you see that progressing in the future?
I think it's a matter of exposure and education of people in the other fields, because it is a very foreign theory. And I think more and more as we get more graduates and we get out into the public, that you're going to see it become really mainstream probably within the next decade, if it hasn't, if it's well on its way already. I work in conjunction with doctor referrals now. I have everyone from internists to orthopedic surgeons, and I even work with a dentist that does neuromuscular dentistry, working with a lot of TMJ problems, and I do a combination of massage and acupuncture to augment her treatments, and we've had incredible results.
Good. Well, I promised Diane that I would donate my body to science and allow you to demonstrate some acupuncture on me, as well as some a massage technique, which may not in fact be done at the same time and during normal treatment, but just so we can have a visual of what all Diane does. We're going to come back in just a moment, and Diane's going to demonstrate her craft. Welcome back to Lifelines. I'm Larry Linehauser, and at Diane's request, I'm naked. Just kidding. Diane is now going to walk us through an acupuncture series, and I will turn it over to her, and then I will do what she asked me to do.
Okay, Larry, I'm going to have you lay down on the table, face up, please. And I'm going to do a really simple treatment on him today, which is just the 5 points that I'm going to put in him. It's just a calming, just to kind of calm the mind, re-energize the body, get like a circular energy of qi going in the body. And so I'm going to swab these points. We're going to do points, large intestine 4, which is between the thumb and the first finger, and the liver 3, which is between the big toe and the second toe. And this one is a point called yin tong. Just grab one.
Diane, is this going to hurt?
Well, there's points you feel a little bit of insertion, but these needles are so fine, they're like the filament of a hair, and virtually they're painless. So I want you to put your hands in a comfortable position, because you don't want to move your hands once the needles are in. And I'm going to put this here. Take a nice deep breath in for me. And here comes the first needle. Now, how did that feel?
I didn't feel anything, honestly.
There you go.
Very good.
So,
far.
and sometimes if you have, a real excess condition in the body, have another breath in for me. You might feel the insertion because the qi is really at the surface. Or if you're really debilitated, sometimes you have to really manipulate the needles to even get that arrival of qi that we like to find as practitioners. Another breath in for me.
Now, is moxibustion a part of this?
Yes, it is, and that's using an herb called mugwort, and you use it looks like a cigar. You light it, and you can actually, you kind of peck over the needle with this cigar-like contraption, and it heats the needle. Another breath in for me. And so that's a warming needle technique that sends warmth deep, deep, deep into the channel, and that would be for cold conditions. Now this point between the brow here is called yin tong, and it's again another one just for calming. You might feel that one a little more because there's not as much meat to go in there as there is in muscle.
Actually, I have a lot of airspace in there, so there's not much feeling at all.
Well, how was it? Not so bad, huh?
Not bad at all. I'm surprised.
Okay. And when you're getting the treatment, the practitioner may, manipulate the needles by twirling them, it's sort of like stirring the soup pot. Once the qi starts to settle, you want to stir it up.
So does that open up the flow of the qi by twirling it?
Yeah, well, it's gonna like a puddle on water, if you flick it, it's gonna make a reverberation, so you're just sending that qi, you're kind of trying to, pump it. And so these 4 combinations make a nice figure 8 of energy, and it just opens up the whole body, and that's just a very simple treatment.
How long do these needles typically stay in a person?
They would anywhere from 20 minutes to 30 minutes, or even less sometimes, depending on if it's an excess condition or a deficiency condition. And for you, normally we would leave these in for I would probably leave these in for about 20 minutes if we're just doing a very simple, just calming technique. And one of the other things that I do in combination, usually not when the needles are in, however, I might do it before or after a treatment, is massage therapy, which is just, a hands-on technique of just manipulating the soft tissue. And so I'm going to let Larry experience a little bit of just some,
Anytime.
a little bit of neck release on him. I do this a lot, especially when I'm working with my dental patients. We work in the jaw, inside the mouth even. Sometimes we release a lot of the neck and shoulder tension because that has a lot to do with your jaw and your alignment in your temporomandibular joint.
Does the Chinese term for their massage is called Tui Na?
Tui Na, yes. Tui Na has many different strokes. It even has chiropractic adjustments. It's a lot of times they have things like this where they manipulate you all over the body with liniments, and it's very similar to Western massage techs. They draw upon each other, but I have I have that training as well as neuromuscular therapy. I'm a body logic practitioner. I've been studying for 20 years, so I've studied many modalities. So it's kind of nice to have a grab bag that I can do if someone needed Tui Na, that you could use that. In the Tui Na, there's also things called cupping and gua sha. And gua sha is you use a soup spoon, like a Chinese soup spoon, with tiger balm, and you scrape the surface of the skin. It's virtually painless. However, it'll bring a redness to the surface, and it disperses stagnation. It's an amazing tool. And if there's nothing there, it won't get red. So, if the stagnation is there, it'll come up. If not, nothing will really show up.
In closing on Chinese medicine, can you touch a bit on herbs and the role they play in your practice?
It's a very important role because the herbs is, again, another avenue for really healing the system. For instance, with a cold and flu, someone coming to me for a cold and flu, I would put needles in them, say they have a severe sore throat and they just, they're coming down with the flu. We would want to do points to clear heat, but sometimes the points alone may not be enough, especially if it's a very acute invasion. So you would want to augment using something like a Gan Ling or a Yin Chow, which is a formulation of several herbs, and those will also clear heat internally. So the combination of the two are amazing. So it's much more effective, the combination, with an acute long-term problem too, like if you're dealing with someone with digestive problems or this or that. You really need to augment the herbs to really get a good result.
Okay, can I sit up?
Not with needles in you.
Well, then I have to do my close from here.
Okay.
I'd like to thank Diane Glass for bringing this to us and sharing it with us. And as soon as she takes these needles out of me, I will sit up. But until then, thank you very much for joining us on Lifelines, and join us next time from the Hurricane Expo. Until then, I'm Larry Leinhauser, a.k.a. Pincushion. Take care.
I'm done for the day. I'm Robert Day. Welcome back to Lifelines. And since our show is about health, safety, and wellness, we're going to bring the wellness and health portion back into this a little bit. And joining me at Southside Gym is Josh Norton and Renee Martinez. Welcome to the show. And Josh, what's your background in all this weightlifting environment?
More or less, Rob, my background is in general exercise instruction and corrective exercise as well.
That's good. And about you, Renee, I heard something about you being a boxer at one time. Is that true?
Yeah, I used to box professionally a couple years back, and before then I was a law enforcement officer, and basically been doing this since I was 12 years old, so I've been in it for quite a while.
Okay, because I know we visited the SWAT team, fire department, and other folks, so being a former sheriff's deputy, I know that being physically fit is important, so that's a good thing. Okay, Josh, you're going to take Renee through some of the different routines. We're going to take a look at what folks can do to make themselves stronger, and also what they can do at home, right? Because the gym is very nice, but you don't have to join a gym, do you?
No, that's a very good point, Rob. You don't have to join a gym. There are some real simple exercises that you can do either at a gym or at home as well that can be done with just a couple of dumbbells and a simple barbell, or even just some household items. And we're going to show you a little bit of that, how that can be done today.
Okay, good. Now, you're a personal trainer, so do you go to people's homes, or are you here at the gym? And what do? You show them how to do this and get the most use out of it? Is that what you do?
For the most part, that's right, Rob. No, I don't go to people's homes at this point. I'm too busy here at Southside to do that. But what I do is I work with, for the most part, all ranges of people. From someone who comes in who just needs some general exercise instruction and maybe a new routine because they're a little bit bored of what they're doing, to people who come in with structural problems or are coming off of post-physical therapy. I can also use corrective exercise to help those people as well, to help rehabilitate injuries.
Okay, so basically, I have a sore shoulder, which actually will be my primary excuse for not doing a lot of weightlifting today. But anyway, you would be able to tell me, okay, to avoid aggravating this injury, do this exercise a certain way.
That's correct, and show you some things that you could do on a regular, everyday basis to help strengthen up that particular area and take yourself back to a healthy level.
Okay, good. Well, let's get to it. And Josh and Renee are going to show me how to do some of these exercises, and we'll be right back. Now, Josh, what kind of exercise is this as far as, which muscle groups and all that good stuff?
Well, what she's doing here, Rob, this is called an incline barbell press. And what she's doing here, as you can see very clearly, she's working her upper chest and also a lot of what we call secondary muscles as well.
Okay, so basically all up and through here, right?
Right,
Okay.
exactly. Now, when I mention that word secondary, what I mean is she's also using a lot of biceps, a lot of triceps, a lot of her back muscles, and her shoulder muscles as well to help her complete this movement itself. So it's very beneficial.
Okay, so this would be considered an upper body workout, because I always hear upper body and lower body and that sort of thing. So this would be part of that group?
Right, that's correct, exactly. Very.
So how do you feel, Renee?
Great.
Feel the burn? Is that what it is?
Not really. I can do a little more weight, but
Yeah.
you work out with smaller weights, and then you work up to a higher weights, and then you do sort of a thing of a pyramid and work yourself down and finish up with more reps to get that burn.
All right, good. Yeah, because I know Renee's looking like she's in really good shape. So later on, you all can show me how to do some of this. And okay, so as far as that, and you want to mix it up with lower and upper body, or how does that work?
Well, you can mix upper and lower body together. Typically, what you want to do is keep your upper body movements with the upper body movements and the lower body movements with the lower body movements, just so we keep everything together. A little bit safer that way, and for energy purposes, a little bit easier as well.
Okay, good. Okay, now Josh, what's Renee doing here?
The name of this exercise, Rob, is actually called a lat pull down, short for latissimus dorsi, the name of the muscle that she's working. What this is designed to do is really work her upper back. It's pretty clear the muscles that are involved here with Renee. She's working her deltoids here. She's working her entire upper back. As you can see, her scapula, also known as shoulder blades, coming in together on the way down and spreading out on the way up. And what this is designed to do is not only add muscularity to the upper back, but also add flexibility as well.
Now, I noticed this looks fairly simple, but is there a way to do this wrong? I know she's being slow and deliberate. Is she concentrating on doing it a certain way, or how's that work?
She most certainly is, Rob. She is, right now, this is what we would call perfect technique. This is a very commonly exercise that is done improperly, simply because of the complexity of the exercise. It's one that I see commonly every single day, people swinging back and forth on the gym, on this exercise, moving their body in a direction that it shouldn't be moved, putting way too much effort into it. As you can see, she looks very relaxed. The exercise is very, very smooth, and every exercise should look just like this, nice and smooth with a lot of control.
Now, if somebody's first starting out, obviously it's good to have somebody like you with advice on how to do it properly. Is that true? Is that something that folks probably should do if they're first starting out?
Definitely, that's a very good point. One of the main reasons, or one of the biggest causes for injuries that I experience when I'm working with people, or that when people come in and they inform me of, is that they've taken their exercises too much, too fast. That's something that happens all the time in the health club, and I think for as well as people who are working out alone, they put a little too much umph into what they're doing, and they're doing it improperly at the same time, and that leads to a lot of potential injury, as well as you're not going to want to come back and exercise very much if the last thing you remember exercise doing to you is hurting you. So it's a very good idea to work with somebody as in a partner type setting, or someone like a trainer like myself, who can actually instruct you on how to do the exercises properly and what muscles to focus on.
Okay, so if I were to jump in here, I notice Renee's out of the way here. So as far as if I were to jump in and take a shot at this, you could show me how to do that?
Definitely, in just a matter of minutes.
Okay.
Okay, now what we're going to go ahead and do is have Rob do a few repetitions here. Now, Rob, what you want to make sure is that your feet are flat on the floor, okay? That you're sitting up nice and straight. You want to be sure and keep your back nice and flat, okay? We'll keep your head in a neutral position, all right? And all we're going to do while keeping the wrist straight is just simply pull this bar directly down behind the head to the top of your back, exactly, and up nice and slow. And you want to be sure and really try to emphasize squeezing the muscle group that's at hand. In this case, Rob's upper back. So what he should be doing is really try to tense and squeeze those muscles in his upper back as he's coming down into the positive part of the movement. Now, once again, this is an exercise that's extremely easy to do improperly. For instance, something that Rob could do that would be a wrong thing to do would be to be yanking the bar down in a quick, explosive manner, or to be leaning too far forward or leaning too far back, for that matter. Having an uneven hand spacing. These little details can lead to potential injuries, and as well as just the movement won't feel the way that it should. So, but the way you've got it right now looks good.
Okay, now we're here with the dumbbells, and no, we're not talking about me. What are we talking about?
We're talking about Renee's deltoids at this point. This is called an overhead dumbbell press, and she's exhibiting perfect execution right here. This is something that can be very easily duplicated at the house as well, with a simple, with a hard chair with a flat back on it, similar to this bench here. Once again, a pair of dumbbells can be purchased at your local sporting goods store at a very convenient price. But this is a very effective exercise, probably the best exercise overall to include every muscle in the deltoid region. And can be done, once again, should be done with very light weights to start off with for beginners. And the technique can be challenging. Renee makes it look pretty easy, but for the most part, it is a very challenging exercise. So you want to start off with very light weights, and as you get stronger, slowly progress up to something that's a little more challenging.
Okay, good. Now, as long as she's there, we're going to take a look at another exercise. But before we do that, this motion here, that reminds me of, was that the military press, or is that something different, with the rifles and the whole bit like that?
Very similar to the military press, just a simple variation, Rob, is all that is. Military press would be done with a barbell. Typically, that's how it's done. Military is just referring to the motion itself, the type of movement. We're just doing a little alteration here with the dumbbells to demonstrate how easily this can be duplicated at the home.
Okay, good deal. All right, now, as long as Renee's here, dumbbells are here, what else can she do with this setup?
Well, to show you just how easy you can transition from one exercise into the other without moving whatsoever, we're going to go ahead and move into a bicep curl with the dumbbells. She's going to do the curls with one arm at a time. You can do 2 arms at a time. You can turn your wrist in, turn your wrist out. There's different styles to do it depending on which one is your preference or what part of the muscle you want to work. And that's simply the only point behind putting any kind of variation or different kind of, moving your wrist in a different way or doing 2 arms together or 1 arm separately. It just simply depends on what part of the muscle you actually want to hit. But what this does is actually work the bicep muscle that everybody knows and loves. And she's doing the single arm variation here. Very effective, and once again can be done in conjunction with the shoulder press, because all she has to do is bring the dumbbells down in this fashion and perform the movement. Doesn't have to move at all.
Okay, good. So anybody who's seen the show knows that I could use some, work out the guns here a little bit. That would be one thing I could do. And then as far as anything else in the arm that we can do, if I wanted to increase the size of my arm?
Definitely. Well, there are other exercises for the biceps. This is the most traditional and what we call the most compound movement. Compound meaning overall entailing, the most basic movement. Now, you do have the rear part of your arm called the triceps, and that's the area that we're going to focus on next.
Okay, good. Well, let's take a look at that, because we're going to get Rob's guns in shape here. All right, appreciate it. Okay, now this is the other exercise you told me about to work the other part of my arm.
That's right, to work the rear part of your arm, called the tricep. Okay, very important to develop this muscle. This is a muscle that is normally neglected because everybody thinks of having that big bicep muscle, and they forget about that real important one in the rear part of the arm. This is a great exercise for tightening and toning that muscle. Once again, something that can be done in the comfort of your own home on a hard surface chair, on a bench, or something like that. Also, this works the muscle. Those triceps is the muscle that women are always usually complaining about, that it's the softest part of their upper body. The wave in the arm keeps waving goodbye after they're done. You've heard that before.
So, Renee, I notice you don't have to worry about the back of your arm. How often do you work out your tricep?
Pretty much every other day.
Okay, now, Renee, do you split up your exercises as far as upper body and lower body? You don't do, say, this 3 days in a row, do you?
No, I don't. I skip a day in between. Usually do upper body one day, lower body the next day, upper body, lower body, to give your body to get a chance to heal and recover from the burn before. So.
Okay, good. Anything else you want to point out on this particular exercise, Josh?
Just that it should be done, once again, like all the other previous exercises, Rob, in a slow, controlled manner. You can vary your hand spacing from close to wide.
Okay.
To hit different parts of the tricep, outer tricep, inner tricep. It actually has 3 heads, so this exercise definitely hits all 3 heads of the tricep, but you can focus on one head or one part of the muscle more so than the other just by varying your hand spacing. But that's really about it. That was executed perfectly.
I'd like to thank Southside Gym for letting us use their facilities here today. I learned a lot. And also I'd like to thank Renee and Josh for showing me the proper technique. And any last thoughts, Renee?
Well, basically, I guess I've been doing physical fitness all through my life, and basically it's given me the drive and the endurance, and being a mother of 4, that's really helped me out to keep up with them and maintain a healthy lifestyle.
Yeah, I never would have guessed the mother of 4. And Josh, what do you think?
Well, like Renee, I've been doing this for the most part my entire life as well, and just thinking about myself and how much it's helped me out and how great I feel because of it. I'd like to see everybody on the face of the earth feel good and healthy, and see them improve the quality of their life as well as their confidence as well. So, of course, in my eyes, there's no better way to do that than to exercise on a daily basis.
Well, good. In fact, I'm going to improve my quality of life right now. I'm going to give this a shot. So, do me a favor, Josh. Hold on to this.
Sure.
Grab this. Okay, so I have to watch my proper technique.
Okay, good. And we'll see you later, Rob. Bye-bye.
How am I supposed to get out? I'm stuck.
Thank you for joining us on this edition of Lifelines, on this special segment where we focused on health and wellness.
Sure did, Lair. And next month, we'll be at the Hurricane Preparedness and Safety Expo, June 21st at the DeSoto Square Mall, and we hope to see everybody there. And we'll be interviewing the various participants and learn how the folks can help prepare themselves this hurricane season.
So until next time, remember,
Safety is your lifeline.
For questions or story ideas for Larry and Rob, you can send an email to lifelinestv@aol.com.